I'm not against these vaccines. I think that especially people in risk groups, vulnerable people, should have that protection if they want to, voluntarily. Of course. Okay? When you have informed consent, when you put all the papers on the table and you inform your patient, this is what we know. We know that, they have this protection. Could be that it wanes over time. Could be that you need to take more injections, later on, or whatever. And you have a discussion with your patient and you agree that this is a right treatment. Fine. You haven't violated anybody's will. You haven't violated their integrity. And that's what I'm worried about that we're doing now. And if we violate that doctor-patient relationship, one time, what will people expect from health authorities next time?
Welcome to Mind the Shift. My name is Anders Bolling. All through this pandemic, there have been protests, first against lockdowns and later against vaccine mandates. The latest striking examples are these massive truck convoys inspired by Canadian protesters that and have been seen also in the United States, in Netherlands, in Australia, and other places. But the mainstream media and leaders haven't really covered much of these manifestations, though. They haven't been ignored completely. I've read about it in Swedish news media a little bit, but compared to other big manifestations, they haven't really been covered very much. And there have also been, all along, dissenting voices among doctors and epidemiologists, experts who have had a critical view of the blanket policies of tough measures that have been rolled out in most countries. With me today from Malmö in southern Sweden is Dr. Nils Littorin. He has a doctor's degree in clinical microbiology, and he is the initiator of the so-called doctor's appeal, Läkaruppropet in Swedish, which on its website states that it is for the shielding of vulnerable groups and against harmful restrictions. Welcome to the podcast, Nils.
Thank you. Nice to be here.
So as of today, as far as I have seen on the website here, 25,000 people have signed the appeal.
Yes.
Of which 1,500 are hospital workers and around 100 are scientists. So how many are doctors, would you say, Nils?
It's about 200 people now who are doctors. So we have professors, researchers, associate professors, clinicians, even some doctor students, a few of them, brave young people who have chosen to speak up against restrictions, lockdowns, forced measures like vaccine passports, which have no scientific basis and cause a tremendous amount of harm, both to the physical well-being of people. I'm talking about lockdown restrictions and so on, and also immense psychological harms, and also damages confidence between health authorities and the people.
The response has been pretty massive. I mean, despite the fact that almost no mass media has told about this appeal. What does that tell you?
Well, there is a undercurrent, below the surface of people who are speaking out against this. And sometimes you can see it, like in our appeal, that especially in the beginning of the appeal and also around Christmas this year, there was a huge surge in news signatures of people willing to sign it. And there is also, there was a manifestation in March, manifestation in Stockholm a week ago that gathered, I think, over 10,000 people. And for Sweden, that's a lot. Swedish people don't normally go out on the streets. We are a passive people. Compared to France or even Spain or other countries, we seldom march. We seldom, make our voices heard in that kind of matter. But so 10,000 people in Stockholm is a lot of people.
Mm.
And that means that there is a pretty forceful, strong undercurrent of discontent with the current COVID politics, including the vaccine passport. Even in Sweden, who had the least restrictions of all countries taken together during the pandemic. So even here there is discontent, and that tells you something, that these measures are anti-people, they are dangerous, they are not serving any purpose whatsoever that is good. As I can, in the scientific literature, you can try to find epidemiological studies that show that lockdowns or harsh restrictions work in the sense that they reduce the number of deaths from COVID, but there aren't any epidemiological studies proving that. So on the contrary, the ones that I've looked at least, see the opposite. There is no correlation between harsh measures, restrictions, and lower amounts of deaths of COVID-19 or excess deaths, which is an even better measure.
Yeah.
So there is no correlation, and if there is no correlation, then you cannot talk about a causal relationship, which unfortunately a lot of researchers, a lot of politicians think and act and talk like there is a causal relationship between harsh restrictions, lockdowns, etc., and reducing, spread of the virus or deaths or hospitalizations or admissions to ICU wards. But the correlation doesn't exist.
Doesn't exist, no. No, it's obvious to anyone who looks at the data from different countries at this stage, at least, 2 years into this pandemic, you can see that.
Yeah,
as you say.
Yeah, in the beginning, I follow pretty closely several researchers, and one of them is Martin Kulldorff from Harvard University. I've also interviewed him. I've talked to him on a couple of occasions. I have great respect for him and the Great Barrington Declarations, which I encourage people to look up if they haven't seen it. Extremely interesting initiative, which I also signed, and which was the model really for our doctor's appeal in Sweden.
Oh yeah, I was going to ask about that, because we had both Sunetra Gupta and Martin Kulldorff on the podcast here before. So and we've been speaking about the Great Barrington Declarations before. Yeah. So I was going to ask if this doctor's appeal was based on that. Is this a Swedish version of that?
Yeah, both Sunetra Gupta and Martin Kulldorff are great heroes in my eyes. I mean,
we have to say also Jay Bhattacharya is the third person behind it.
Exactly, yeah, and also a lot of the signees of the declaration. I mean, putting all their prestige and all their their whole career basically on the line, to speak the truth about this pandemic. I think, but anyway, just great role models for me as a physician, as a doctor, and researcher.
Yeah. So, that Kulldorff was canceled from LinkedIn the other day. He was banned, but then they took him back because there was an article about it in the what's it called now, the Brownstone Institute's website.
Right.
So they didn't dare to keep him canceled, so they took him back again.
Right. Yeah. So that's another thing that of this pandemic, that it's just so crazy that if you talk about, Martin Kulldorff is interested in collateral damage of the measures of lockdown. He follows this very closely, and I think one collateral damage that is obvious of this pandemic is that the censorship is back. We thought that censorship was something that was done in Soviet Union, Nazi Germany, these kind of places, North Korea. And what you see is really that it has resurged in our so-called democratic countries, and it's crazy. And people are being canceled, censored. I have had three videos taken away from YouTube, for example.
Okay.
When I have made interviews with Swedish doctors and professors. So it's just I never thought actually that I would live to see something like this in my country, Sweden, which is supposed to be very democratic and open, free society, and other countries as well. I'm really, really taken aback about a lot of things that's been going on in this pandemic. And I know I'm not alone, but, so Martin Kohlhoff says that maybe, you can postpone some of the spread of the virus, by doing a lockdown or whatever, on the margin. Maybe you can postpone it, but you can't prevent the spread of the virus like that. And you cannot, protect the vulnerable groups with harsh restrictions and lockdowns, because the vulnerable groups will be damaged by the lockdown itself. So, and I think that, and this has been proven without a doubt now, that this was the most catastrophic public health policy that has ever, during the history of man, ever been implemented.
He usually says, Martin, that it seems as if all the preparedness plans that were in place since 20 years ago, 30 years ago for pandemics were just thrown out of the window. They were just abandoned all of a sudden, except in Sweden then, because Sweden was the only country that more or less followed these old pandemic preparedness plans. So I mean, what do you think happened? What's your explanation to why the whole world just suddenly, or at least the leaders of the world and their advisors, they all of a sudden they just switched course and began imposing this very strange experiment of lockdowns all over the world? What happened, do you think?
Yeah, like you said, Sweden was the control group in a mass psychosis experiment. So all of the world locked down, followed Communist Party of China, and locked down their countries without any, evidence that this would work, without any hint. There wasn't even, like you said, in the pandemic plans, any mention of lockdowns anywhere. And, masks were even by the leader of the United States, CDC, or is it NIH? I forget, Dr. Fauci.
Yeah.
The pandemic responsible person in the beginning of the pandemic said that masks are completely useless, basically. They cannot stop the spread of the virus. And, a couple of months later, they were mandatory across the world, except for Sweden. So Sweden had no masks. We had no lockdown for all of 2020, okay? This is really, really important. And it's really important not only for me as a father, who my children could go to kindergarten, could go to school every day during the pandemic. It was really important for me, for my family that I just started.
Of course.
Otherwise, we had had. I mean, I have friends in Spain, and they talk. They have nightmares still about the 3 months that they were closed in their houses and couldn't leave their house, and the children couldn't go to school. They just don't. They don't want to think about it. They have been traumatized. So it was.
Talk about collateral damage.
Yeah, I mean, and there was a study made from the first month of lockdown in London, which showed that head trauma in children, traumatic head trauma in the emergency wards of the hospitals of London had increased by 1,400%.
Wow.
And, children don't bang their head, at that amount accidentally. It was child abuse that had soared. You can see that even in Sweden that didn't have any lockdown, but we took some, voluntary measures, recommendations that some of the sports activities for children were closed. There were, a lot of these with social distancing.
Yeah, social distancing and restaurants. During some period, restaurants had to close early and all that.
Yeah, and you couldn't visit. People were afraid to visit their relatives, etc. So even in children, children suffered psychological damage, which have been showed in a children protection agency. They have measured this, but in the places who had lockdowns, it was even worse. Catastrophic damage to children, especially children in vulnerable households. If you live in a villa in the countryside, and you can, walk in the woods or walk in your own park or in your own garden. Maybe you can even have your family over or whatever. You don't suffer as much as someone who lives in a 2-room apartment with 3, 4, 5 children, 2 adults. They will get on each other's nerves, and they will suffer tremendously during lockdown, which they did. Mm. And this one of the scariest studies, except for this one with head trauma, comes from, I think it's Long Island, United States, New York, where they measure the IQ level. It's not really IQ, it's development level, but it's corresponding to IQ in infants, in young children that has been born during the pandemic. And they have suffered a corresponding 22 points loss in IQ compared to those who were born before the pandemic. And 22 points on an IQ scale, for those who don't know that, is a lot.
Yeah, that's huge.
These children have correspondingly 78 as a pro-median in IQ, which the normal IQ level is about 100. So, and if you have 70, you're counted as slightly retarded. I mean, you need professional help most of the time if you have 70, or you're, at least in Sweden, you're entitled to it. But
that's one study. But it's fairly big, or it's reliable.
Yeah, I mean, it has been reported widely. What they do in this study is that they followed, with regular tests, each children who are born each year. So they have a very large data set to compare with, and it's clear the drop. It's no question that the drop is there. And
sounds very scary, I got to say.
Yeah, it's scary, and the reason is the lack of social contact, lack of interaction with their peers. Everything is closed. Kindergarten. The social trauma or the psychological trauma of being just locked in a house with their parents or whatever, and the parents don't feel well at all. I mean, there's so many negative impacts of these policies. And yeah, that's what I'm going to say. And that's what is so important, that Sweden didn't do this, because now we know that that it doesn't work, because Sweden was the control group, and we have in 2021 we had the lowest excess death, according to the Economist, the paper Economist. We had the lowest excess death in all of Europe. 2020 we were among the bottom third of Europe, the countries of Europe, and now in 2021 we have the lowest deaths of all countries. Yeah. So it's clear that restrictions, lockdowns, and forced measures don't work. And it's clear that recommendations, without forcing anybody, works probably much, much better, because you have a much less impact on, on the society. We have schools, we have hospitals, we have police stations for a reason. It's not because, someone invented them because no good reason. We have them. And when you interrupt those basic things of society, people are going to suffer. And it's scary to me how easy it is to close schools. Like schools don't matter, or have, this distance education, which a lot of children don't like at all and doesn't work as well as in class education, and which causes tremendous harm. But but for example, in Sweden, sometimes now they have these light restrictions where it's up to the, head principal of the school to decide if we're going to, okay, we have 5 cases now, 5 positive children, we're going to close down this class, or we're even going to close the school or whatever. But you don't do that anywhere else. You don't close down any, fire departments or Volvo cars, industrial plants. You don't close down any electrical firms or, any shopping malls. Hasn't been closed one day. So why is it so easy to close the darn schools? I don't understand. Children are least affected of this disease of all people.
Yeah, there's a more than 1,000-fold difference in severity of the disease between the youngest and the oldest, I guess, or several thousand times difference.
Yeah, I mean, probably 3,000. I mean, if you're over 70, you have a 3,000-fold increased risk compared to a child to die of COVID-19.
Yeah.
I'm sure a lot of your listeners are familiar with this, but there was a study made during the first wave of the pandemic in Sweden, where most of the deaths took place, when we didn't have enough testing material, we didn't have any protection equipment in the hospitals enough for everybody. We didn't have any treatment for COVID-19, rolled out like we do today. And still, every Swedish child went to school every day between 1 year, that's kindergarten, and 16 years. And you know how many of these children died during this time period?
0.
Yeah, 0. So 0 children died. And this study was later confirmed by several others. But recently there was a German study published which couldn't find a single healthy child that had died from COVID-19. I think it was 5 to 11 years old. So children, for this disease is comparable or even lighter, less dangerous than normal flu for children.
Yeah.
Any restriction,
Mm-hmm.
so any restriction, and that's the fact, any restriction or any lockdown that causes harm to children is by definition not proportional. Because children don't suffer any harm from this disease. And which group in society is most important? I would say as a father that children are the most important group in society. A disease that kills children is, for me at least, more of a problem, more lethal, more dangerous, or worse than a disease that only or just kills those who are above 80 years old.
Yeah, that's interesting. It's a bit of a philosophical question, really. But it's difficult to talk about it, but in a few years we might be able to do that. But it is like, I mean, the fear of death is so strong in people that, I mean, even if, as you say, only, quote unquote, only 80, 85-year-old people die, people still think of it as a lethal disease. And if the authorities are efficient enough in inciting fear in people, people will do anything just to avoid this lethal danger. And when you look at the statistics that are published in the newspapers every day, you get the impression that if this disease hadn't occurred, everybody would have had eternal life. If you see my point, because you only see these death figures from COVID-19. You don't see any other death figures. You don't see any cancer death figures.
Exactly. Yeah. I mean, there are huge exaggerations, and we can talk about them. But I also want to make a point, and that's, I mean, I'm a physician. I've seen people in hospital with COVID-19, even young people. So it is a lethal disease. It is dangerous, and especially for older people with comorbidities that have, the median age in Sweden is 83 years old among the deceased.
And that's a bit higher than the average longevity in Sweden?
Yeah, and especially for men. I mean, for men, I think the longevity is about 79, 80 years old or something like that. So, the median age of those deceased was very high. That doesn't mean that it's not a lethal disease and that we shouldn't protect the elderly. I think we should, and we should maximize protection for those who are at greatest risk of this disease. This group is very well defined. It's the older, fragile, people with certain comorbidities, you could say, but above all, age. Age is the number one factor. So we need to protect these people, and we need to avoid causing harm against the young, healthy population, because then we are not helping anybody. And this is what the Doctors' Appeal of Sweden and the Great Barrington Declaration have in common, that we propose measures that protect the vulnerable and that protect children. So children should go in school, should be in kindergarten. But if you have a teacher, for example, that is over 60 years old, maybe has some underlying disease, should be offered to work from home. Simple. You can work, you do administrative work, you help your teachers to correct tests or, whatever. And we remove you from society when we have high transmission of the virus. But children who are not vulnerable will keep going in school because they need it.
So would it be fair to say that the principle of your appeal, as well as the Great Barrington Declaration, which are very similar, is to protect the elderly and the vulnerable groups from the disease and protect the children from the restrictions?
Exactly. In a nutshell.
Okay. So that's, to me, that makes sense.
Yeah, that makes sense. And if you have that perspective on things, then you can find, the best possible way to, in a workplace, how do we protect the vulnerable? How do we protect those who are not vulnerable so they can keep on, making a living, go to work, so their children are not affected, etc., etc. Because when you do restriction for example, we have some silly restrictions now in Sweden, even though we have very few, we have some. And for example, bars cannot be open after 11 p.m. And this is all across the country. So this causes, of course, massive unemployment in that sector and causes businesses to close, bars to close. And unemployment is hugely associated to psychiatric illness and to death, to die prematurely from different causes. So unemployment is one of the worst things that can happen to a society and can happen to a person just health-wise.
Yeah. Let me ask you, Nils, you initiated this about a year ago, I understand, or less than a year ago, March in 2021, was it? The appeal.
That's right.
Yeah. So I want to ask, did you do this initially mostly to protest or to have objections to overly harsh restrictions, and then it gradually switched into being, more of an objection to blanket vaccine mandates, which haven't been that harsh in Sweden, but still, there's a big pressure on the whole population to get the jabs. Because the vaccine rollout hadn't really begun when you initiated this appeal, so that happened a little bit later. Was it like that?
Yeah,
order of things.
From the beginning, it was clear that they were gonna push for some kind of vaccine passport or vaccine mandate. Early in 2021.
Yeah.
So our appeal has from the beginning been against vaccine passports and vaccine mandates.
Okay.
And it wasn't until I think last summer that it became clear that they were going to introduce it in some form in Sweden, and they eventually did in December. I think it was in 1st or 3rd of December last year, like 2 months ago. They introduced vaccine passports. We were one of the last countries in Europe to introduce it. If you look at Denmark, Norway, they introduced it last spring, and then they removed it for some time, but they were much ahead of us. And it's so clear if you look at the data, if you look at the epidemiological data that is widely available online or in epidemiological studies, that the vaccine passports has not done zip to prevent spread of the virus or deaths. And it wasn't feasible to think that they would.
No, we're going to come back to that and what's happened with Omicron and everything. But I think it's difficult to, as far as I can see in this debate here, difficult to have any objections at all, generally, and not be, lumped together with a general pile of anti-vaxxers and conspiracy theorists that can't be trusted. If you have any objections in detail, at all, then you're lumped together with the so-called anti-vaxxers. So are you an anti-vaxxer?
No, and I think that's something that they throw at you to discredit you. And I mean, for example, in Sweden, there are 97% of the population vaccinate their kids. So any vaccine anti-vax group in Sweden will be very, very marginal and small before this pandemic started. We're talking about a few percent, and how many of them are consciously against vaccines, and how many of them are just marginalized people that don't go and seek healthcare more generally. So anti-vaxxers promoting seriously people not to take vaccines, it's a very, very marginalized but active group. Okay, so the ones who have signed the Doctors' Appeal of Sweden are not anti-vaxxers. We are pro-science. And there is a very good case, pro-science case, to be against vaccine mandates and vaccine passports. And the fundamental question here is, health authorities, to be successful in the long run, need to have the confidence of the public. If they don't have confidence of the public, then public will hesitate to do the recommendations that the healthcare providers recommend. They will not trust the authorities because, is this how you make decisions? Then I don't want to have anything to do with you. I already had COVID, and now you're going to force me to take a vaccine, even though I know that my natural immunity is superior to what the immunity that the vaccine offers. Are you going to force me to do something that I'm not, I don't need? Then I don't want anything to do with you. I mean, that's the reaction of some people, unfortunately. And then you have damage, distrust, and that can take decades to repair. And as a physician, I'm scared of that. I'm scared of people losing faith in our healthcare system. And I think that the vaccine mandates and vaccine passports, which are two sides of the same coin, just, handled a bit differently.
There's no difference really, you mean, in principle between mandates and passports?
No, vaccine passports, I mean, it prevents you from, you become a second-class citizen in your own country.
Yeah, but it's still possible not to take the jab. I mean, if you avoid going to the cinema and theaters and things like that. But if there's a vaccine mandate, you're just by being a citizen, not being vaccinated, you're violating the law, so to speak. Yeah,
exactly. Yeah, I mean, of course, mandating it is even worse, and it's crazy that people can't. I mean, Western democracies like Austria is even.
This very day when we record this, I think Austria is going to impose this, which is a bit strange considering Omicron and everything. So
no, it's Anders Tegnell, our head of the pandemic response in Sweden. He's a physician. He said that in 2020 that the whole world went mad. Okay, except for Sweden. People around him, he said, that he in other countries internationally that he had contact with had gone, and politicians all around had gone mad. And I think that's the case, that some countries like Canada, Austria, Australia, they have gone mad. They are not longer, cannot count them as full democracies anymore. I mean, look at how they talk about the unvaccinated. They talk about them like vermin, like they were rats that need to be dealt with, that they have lost patience with them, that they are like the leaders, the presidents are pointing their fingers at a group that is blamed for all the wrongs of the pandemic, when in fact, it is the leaders of these countries that should be blamed for not protecting the vulnerable and for imposing crazy, very harmful measures during the last 2 years.
I have 3 examples here of what you're saying. The French president, Emmanuel Macron, he has said that unvaccinated people are not proper citizens.
Yeah.
The Canadian PM, Justin Trudeau, has said that unvaccinated are misogynist racists.
Yeah.
And the former British PM, Tony Blair, has said that those who don't take the vaccine are idiots. So there's 3 examples.
Yeah, and that's the language that you hear repeated any day, online, in Facebook, Twitter, because people buy into this mass hysteria, and it's so easy to find a scapegoat, and blame everything on these idiots who are so, unscientific and don't follow the rules or whatever. But let me tell you something. Any person who have had COVID have natural immunity that is superior to that offered by the vaccines. This has been shown in several large studies. The best one that I looked at was from Israel. In that Israeli study, it was 27 times less likely for a person who had COVID to be reinfected compared to a vaccinated person with Pfizer, 2 jabs, to be infected. So
symptomatic disease, yeah. Reinfection was 13 times, I think, wasn't it?
To have symptomatic disease with COVID. So natural immunity is superior, and that is no surprise to anybody who knows something about infectious diseases, or the immunologic response to pathogens. So to force people who have already have superior immunity to take a jab, which includes a little but some risk. I mean, there was 3 famous cases in Sweden, people dying from the vaccine. So these are not risk-free treatments. But to force people to take something that includes a risk when they don't need it, that is crazy, and that is anti-science.
Yeah, I've been delving into this natural immunity thing myself a bit lately, and there was a second recently, I think on the 24th of January or something, there was a second big study, this time no less from the United States, from the CDC actually, which confirmed what the Israelis had come up with. And it said that, I mean, you could see that as you say here, natural immunity was actually a little bit, not very much, but you could, anyway, you could measure the difference. It was better, more efficient than only having taken 2 jabs and not having had the disease when it comes to avoiding hospitalization, at least. Yeah. So it is more effective. So I'm thinking in Sweden, we don't have a vaccine mandate. We have this vaccine passport, but it's not a big problem, but it is a problem for those who want to go to the cinema theaters and things like that. But still, there is a pressure on everybody to take the whole package here.
But listen, it's not only about the cinema and going to the theater. I have several friends who have lost their jobs.
Oh, really?
Yeah. Oh, yeah. Because they won't take the vaccine. Because the employers, they push this very hard at some places. Because it's about how do you say, to submit. It's about submission.
Mm.
That you need your employers to do what I tell you, or else. I look at it that way because it has no rational basis anymore.
No, but I mean it's not the law. I mean the government hasn't forced every employer to impose these kind of rules. Uh-huh. That's every employer for himself or herself to decide that, I guess.
Yeah, I mean they require it in large part of the several municipalities require it if you want to work in the healthcare, for example.
Okay.
In the care of older people, also in some hospitals require it when they employ people, and we talked about natural immunity, and now with Omicron, it's clear from the data from several countries that it spreads everywhere. It doesn't matter now if you're vaccinated or not,
no,
because it spreads anyway.
Yeah,
I mean the vaccines are a personal protection that is supposed to protect yourself from severe disease and death. That's okay, but they do not prevent the spread of the virus.
Did they protect the spread of the virus earlier when we had the alpha and the delta variants? Do you think?
That's hard to say. I mean, there is a case to be made that they did. But on
that was one of the big arguments why everybody should take the vaccine, because then you can protect vulnerable groups that way.
Yeah, I mean, yeah, okay. But these things are quite complicated. And I don't think that anybody really knows, because there are so many contradictions. So, for example, you can see those in several studies were made that vaccinated people would transmit the virus as at a less not stop to transmit it completely, but transmit it less than unvaccinated people, for example, in a household with the alpha variant. So, but at the same time, you had studies demonstrating that countries with higher degree of vaccination did not have a less degree of deaths, or did not have a less degree of spread of the virus. They didn't have less cases. So it was contradictory. And this is, I mean, immunology, infectious diseases, microbiology are fields that are extremely complex and great fields for research. I mean, I think in the human body, there are several complicated systems. I think the brain and the immune systems are the most complicated.
Okay.
And therefore, to mandate people, things that we have never done before, like taking experimental vaccines based on temporal data that can be changed from 1 month to another, doesn't really have any scientific basis or value. I think it's a very fragile base, so to say. I mean, this can tip over any second, and now it has done so.
But the vaccines are tested, of course, but they are preliminarily approved, but they are tested. I mean, it's not. I mean, you say it's an experimental kind of treatment, but it's some people would say that it's a stretch to say that, because I mean they were tested beforehand before they were rolled out. At least.
So okay. So what I mean by that is normally, I mean, for example, in my research, I studied a vaccine from the Streptococcus pneumonia, pneumococcal disease, common cause of pneumonia in children and adults. And when the child vaccine was approved by the FDA in the United States in year 2000, the study that approval was based on was a randomized controlled trial, double-blinded, which is
standard procedure in this
standard procedure
context.
Which you absolutely need to get an approval, that had been carried out between 1995 and 1998 with about 35,000 children, and then it took another 2 years before it was finally approved. So at least 3 years of randomized controlled trial, and then another 2 years before it was finally approved, okay, with 35,000 children. Now we are vaccinating children all around the globe with mRNA vaccines. Do you know how long they have studied this vaccine in children?
Not very long. I don't know how long.
Yeah, when it was approved in Sweden, they had one randomized controlled trial from Pfizer, which had a follow-up of 1 to 2 months. And in the abstract of that study, it stated that this is an ongoing study. It's not completed yet. So it's an ongoing clinical trial, phase 3 trial, that is supposed to be finished, if I'm not mistaken, in May 2023.
Okay, so that's what you mean when you talk about experimental treatments, because we have it's for months instead of years, which is the normal procedure.
Yeah, and normally you need to finish your phase 3 trial before you get an approval. Now they have an emergency they had an emergency use approval when they were first approved by the FDA in the United States. In Sweden, they have something called, I think, temporary approval. I'm not sure about the exact phrase here, but it's not the normal approval. It's a temporal approval that needs to be renewed each year. So it is possible that these vaccines, in Sweden at least, or in Europe, will not finally get the full approval. It's possible. Yeah. It's not, perhaps, I don't know, maybe it's not very likely. It would be a tremendous disaster.
At least it's not inevitable, at least, yeah.
Yeah, but
I know that you have said
that's how these vaccines are being.
Yeah, in some
and for adults.
Yeah, go ahead.
Yeah, so you need to look at the data. You need to look at the clinical trials really to understand what's happening. And the clinical trial for adults, which had a lot of people, like 40,000 Pfizer's clinical trial, but the one for children had only 2,000. So we need 40,000 adults to experiment on, in our clinical trial. I think that's a good number. That's a large number. But children, 2,000? That's very strange to me that you only need, because if you have a side effect that is 1 in 3,000 or 1 in 2,500, you will not find it in that study. You would risk not finding it.
There's a lot of talk of the myocarditis risk here, and there are several studies I heard just the other day, new American studies showing that in young males between 18 and 24, I think it's the risk is 1 in 1,900 or something like that, which seems pretty small, but in a large population, it's going to be a lot of cases. But anyway, just to pinpoint something that I know you've been talking about here, and which upsets some people. You've been making references and comparisons with the so-called Nuremberg Code in other interviews and speeches, and how it might have been violated in many parts of the world now that we have these vaccine mandates. And I understand that the Nuremberg Code, or the Nuremberg Convention, which is another word for it, was replaced in 1964 by the Helsinki Declaration, or Declaration of Helsinki. Can you explain what you mean by this violating the Nuremberg Code, and what it is that you're talking about here, the reference?
Yeah, so some people get upset. Oh, you shouldn't compare what we're experiencing now to Nazi Germany and the lessons from. But I'm not doing that, actually. I'm not saying that what we're experiencing now is in any way comparable to Nazi Germany. I think that would be a very large stretch, okay? But you can't either be prohibited from talking about the Nuremberg Code, because the Nuremberg Code is so essential to all of medical ethics thereafter. Basically, there were very little medical ethics before the Nuremberg Code, which was basically, they rounded up the Nazi doctors after the Second World War that had committed huge atrocities, killed thousands, hundreds of thousands of so-called patients, committed inhuman experiments on them against their will. And I believe 7 of the doctors were sentenced to death, and several others were imprisoned. Now, the lawyers and the doctors at that time that were involved in this, they decided or thought that this should never happen again. And therefore, they made some points, in the Nuremberg Code. They wrote it down. And the first point is so very clear. You cannot force anybody to take a medication or an experimental medication without informed consent. And you cannot fool anybody to take it. You cannot push anybody to take it. You cannot use your influence so in a way that you convey someone, to take it. You need to be, I don't have the exact meaning here. I urge people to look it up, but the first paragraph is very clear. There should be no force or no, mandatory medication. And I believe personally that we are violating this code in a massive scale, because we, even with the vaccine pass, in places like Austria for sure, but even in Sweden where we have these vaccine passports, if you read the Nuremberg Code, it's clear that we are violating that.
Well, I know not everybody agrees with you.
If you lose your job, or if you lose the right, if you become a second-class citizen in your own country, if you can't go to the cinema, can't visit places, you can't do this, you can't travel. The list goes on both on things that they prohibit people from doing or are talking about prohibiting. This vaccine passport is basically a carte blanche. They can inject whatever they want into this vaccine passport. Next month they might you can't leave your own town. Is that a mandate?
Our new Chinese future, perhaps.
Yeah. So they can and who say yes to this vaccine for thinking, oh, it's a good idea, but you don't know what you're saying yes to. The authorities haven't declared what they include. They just say, oh, it's a vaccine passport. You can't, for now you can't do this and this. Yeah, well, what about tomorrow? What can't I do tomorrow?
Well, that's a question of like you talked about before, the faith in authorities. Are we going to lose it or not? I don't know if you're familiar with how the Japanese government formulates this, their wish that people get vaccinated. Have you seen it?
No. Japanese. Just last point. And they don't even state how many jabs you have to take. Is it 2? Is it 3? Do I need to take a 4th to be, a normal class citizen, to be able to go to a restaurant or travel or whatever? They don't state it. How can you say yes to something like that without knowing what you're saying yes to? It doesn't make any sense.
It's a carte blanche, as you say. Yeah. Yeah, well, I was just sorry I interrupted you there, but I think it's interesting to see how the Japanese government formulates this, because it has to do with what you were talking about, the Nuremberg Code and everything. They say, and I don't know much about Japan and how they have handled this and how many people have taken the jab. I don't know, but I've seen this a couple of times and I checked it up on the Japanese government website, so I know it's accurate and correct. They say it like this: although we encourage all citizens to receive the COVID-19 vaccination, it is not compulsory or mandatory. Vaccination will be given only with the consent of the person to be vaccinated after the information provided. Please get vaccinated of your own decision, understanding both the effectiveness in preventing infectious disease and the risk of side effects. No vaccination will be given without consent. Please do not force anyone in your workplace or those around you to be vaccinated, and do not discriminate against those who have not been vaccinated. It's kind of nice, isn't it?
Yeah, and I'm for that. I think that, I'm not against these vaccines. I think that especially people in risk groups, vulnerable people, should have that protection if they want to, voluntarily. Of course. Okay? When you have informed consent, when you put all the papers on the table and you inform your patient, this is what we know. We know that, they have this protection. Could be that it wanes over time. Could be that you need to take more injections, later on, or whatever. And you have a discussion with your patient and you agree that this is a right treatment. This is the treatment that I want to take, that I feel informed about, and I want to take it. Fine. You haven't violated anybody's will. You haven't violated their integrity. And that's what I'm worried about, that we're doing now. And if we violate that doctor-patient relationship, one time, what will people expect from health authorities next time? I think that's great that the Japanese authorities are transparent and they are very clear about, human rights and about the individual rights to say no. I think that's great, because I think that they will have all the people who need the vaccine. I think they will take it anyway. I think they will take it.
Exactly. That's also my point. Most of the people would take it anyway, especially in this country. They wouldn't have to put any pressure on people. They would. No. I think 90% of the adult population have taken the jab now. I think it would be about the same without any pressure.
Exactly. I mean, the only ones that are succumbing now, are probably, young people. And I mean, do you know that people under 40, males under 40, have an elevated risk of myocarditis from the vaccines, especially Moderna, but also Pfizer. Under 40 males, and especially children, it's like an inverse gradient. The younger you are, the higher is your risk for myocarditis. I mean, if you compare a 15-year-old to a 40-year-old, for example. But up below the age of 40, you have an elevated, and myocarditis, it's not before this pandemic, I had never heard of mild myocarditis. Okay. If you go to the emergency room and they take your troponin test and it's, elevated, and you have are diagnosed with myocarditis, I wouldn't consider that mild. Okay. That's an urgent disease.
Severe condition, yeah.
It's a severe condition. Maybe it will resolve pretty quickly in young people. Maybe, hopefully, most of them won't have any long-term damage on their, growing, developing heart. But I don't think it's fair to call those diseases mild, even if you don't stay more than, let's say a couple of days, one day or a week in the hospital. Because myocarditis, like, myocardial infarction and other, diseases of the heart, when you have this elevation of biomarkers, for example, it causes damage to your heart. And that's not mild. I mean, you don't talk about, whatever. And I think that's a serious.
But the risk is low. It's higher in, like, say, males under the age of 40, but it's still pretty low.
Yeah, I mean, the absolute risk is low. Will be low. I mean, among of course, but you have to compare that risk. For example, let's take the obvious one, like in a child or an adolescent. Let's say a teenager. What are the risks involved? The absolute risk of getting COVID-19 and having to, visit the emergency room with a heart condition, or any severe conditions. It's minimal. It doesn't. I mean, it's like the flu, or less than the flu. We already covered that. Okay, so to get an injection which gives you, I mean, there was a study from Hong Kong which showed in children from the Pfizer vaccine, there was one in I believe 2,700 boys that had the myocarditis.
Yes, and then there was this new study that showed that 1,900 in males between 18 and 24. But I understand also that having the disease heightens the risk of myocarditis in young males. Isn't that true?
Well, okay, so that might be the case. I think you need to speak to a cardiologist that would examine very well the data and if that has been a fact. But there was a large study, I believe from Oxford, that did that comparison. Myocarditis caused by COVID-19 or in positive, PCR positive cases versus myocarditis caused by the vaccine or associated with the vaccine. And it was obvious it's that study that I'm citing, that for males below the age of 40, there is an elevated risk in general from the vaccines. Moderna was much worse, but also the second jab of Pfizer had an elevated risk. And of course, if you then get your your booster, there will be a risk one more time for you. So yeah, I mean, it's more likely to get myocarditis from these jabs in young males than it is from the infection. And especially if you talk about absolute risks, because not everybody will be infected. Okay? Not everybody will be infected, but if you have a mandatory vaccine, you can be sure that everybody get the injection.
That's true. That's true. Good point. So would you say, Nils, that there is a limit to free will beyond which it is warranted to enforce medical treatment? Is there any instance?
Yeah, I mean, there is in Sweden. You have to have the psychiatric institutions. You have medication against people's will pretty commonly.
Yeah.
I work in a psychiatric ward, and this is regulated very strictly by law, and you have to be in a severe psychiatric condition to be eligible for forced treatment. We're talking basically about psychosis or people who don't know what's best for them. You can say like they are so delusional or have severe suicidal thoughts and are deeply depressed. That kind of cases, or have intoxicated them with drugs, and so yeah, there is forced treatment, and even that I'm willing to discuss if that's appropriate. I think there are a lot of doctors that have spoken out against that, even in psychiatric patients. But at least there you have some kind of regulation, when to use it, how, very strict regulation, actually, how to use it. And there is some kind of logic behind it, that these people are delusional, they are not in contact with reality, and if we don't take care of them, they will damage themselves. But even that, I am willing to discuss, and alternatives, because it's a lot of problems associated with taking away the free will of a man or a woman and forcibly inject them with any medication. You will definitely damage the trust of many patients that way.
Yeah,
and we are aware of that, of course, and that's why it's just supposed to be used very carefully.
Here's another example that I think most people are know about, more people than have come into contact with psychiatric treatment. Namely, when you travel, you go to some certain countries with a history of severe infectious diseases, like yellow fever, hepatitis, whatever. You go to certain countries, then you're required to take certain jabs in order to go there. What's your take on that? What's your opinion about that?
Well, fine. I mean, that's a protection for yourself and maybe for the healthcare system of the country. But okay, so I can't go to, if I don't take the yellow fever shot, I can't go to, I don't know, Namibia or whatever.
But it is a vaccine passport.
Yeah,
you're against those within a country. You're against vaccine passports, so I mean, this is a kind of vaccine passport.
Yeah, I mean, those regulations are for certain, tropical countries that have diseases that we basically don't have here, and to go there, you need to get that. So okay, but then you at least you have fine, that's that country's choice to do that, but they don't. That's very different, I believe, that I can't go on a holiday to certain tropical countries if I'm so anti-vax that I won't get that injection. But to have your freedoms taken away from you in your own country, that's completely different, I believe. And to have your, to show your parts of your medical record in your mobile to some doorman at a restaurant or a disco or something, I think that's just humiliating.
Mm-hmm.
And not only that, because I believe that, there is fear in society now, and people believe that because of the fear porn propagated by mass media and uncareful politicians, people believe, or some people believe, that these vaccine passports protect them, protect society from transmission. If you look at the data, it doesn't. If you look at now vaccinated versus unvaccinated people from several different countries, everybody gets infected now. I think everybody knows somebody who had the jabs, 2 or 3 jabs, who had the infection. So the logical basis for the passports, if there ever was one, doesn't exist anymore. So
and many people are actually experts are talking openly about this in Sweden now. I've heard Anders Tegnell, for instance.
Yeah, and even politicians say that the vaccine passports doesn't work as we thought they would. So they are, the before date has passed. I mean, they should be thrown away on the, garbage bin of history. And people who, wanted to introduce these measures should sit alongside the garbage bin of history and contemplate, how was it possible that we did this? How was it possible that we violated Nuremberg Code and we forced these medications on people that A, didn't want them, B, many of them didn't need them because they had already been affected by the virus, hence having superior immunity, and C, without knowing really what the long-term effects of having mass vaccination campaign in young, healthy people during a pandemic. Is it possible that we propagated the spread of the virus this way by putting a Darwinistic evolutionary pressure on the virus so that it escapes the vaccine, hence making the vaccine useless even in vulnerable groups? That's a possibility. That's a theory.
Interesting theory. Yeah, might have happened actually.
So there's a lot of, but a lot of times I forget to mention, that I'm for all kinds of measures that protect the people who need protection. I mentioned, taking teachers who are in risk group out of school so that they won't be affected by the virus. Fine, you do that. You can do that with all, older, overweight, with comorbidities, bus drivers, taxi drivers. Maybe we should take them out of society, have them on sick leave during high transmission periods until the pandemic has subsided. I'm for those kinds of measures, logical measures that protects the vulnerable. But the measures that are taken now don't protect the vulnerable. That's, I think, is perhaps the biggest problem. Because you cannot have, there are no measures that can stop the virus. We've shown that. We've demonstrated that all over the world, that the lockdowns didn't work. Enforcing, half dictatorships in Western society with police controlling you on the street if you have your, vaccine passport, your papers ready, or locking people in their houses for several months, it didn't work. Okay? So we can just forget about that, I think, and need to use our resources and our minds to protect those who are at high risk.
Excellent. Well, maybe Omicron is the ticket out of this now then. So what do you think will happen when this eventually ends? It might end fairly quickly, or at least during this year, I would suppose. What do you think will happen? Will politicians and government advisors admit that they went too far in some instances?
Admit? No. And I don't think so. There is a lot of backpedaling now. There are a lot of people who say, maybe we went too far, with the requiring people to get or encouraging people to get a fourth booster, or maybe we went too far with this and this measure. Maybe it doesn't work to have, have the bars close at 11 o'clock, instead of 1 o'clock. Maybe we went, there's a lot of people who already, try to distance themselves from some of these measures because they are so unpopular, or becoming increasingly unpopular, especially among young people who want to live their lives like normal. But I don't know. I think this has been a great test on humanity, especially on the Western democracies. And I think we've failed on a massive scale. There has been a push to implement certain policies worldwide that have been catastrophic, I think, for public health. And the world's leaders succumbed and degraded themselves to the most primitive kind of, divisive language, hate speech against unvaccinated people, and so on. So, yeah, I mean, with these leaders, we're looking at a pretty dark future, I would say.
But you, Nils, you want to become a politician yourself, don't you? I mean, you run for a party that you have created.
I have a local party in the third biggest city of Malmö, which is running for office in the municipal level. That's true, and yeah, I think we need new leaders, and I hope to be one of them. It's so obvious that they cannot handle in a logical and democratic way. You know, they haven't been able to handle this pandemic. They haven't been able to handle immigration. They haven't been able to handle economy. Yeah, we need new people in office, that's for sure.
Okay, Nils, excellent. Where can people find Doctors Appeal, Läkaruppropet, and also your work if they want to find it?
Yeah, so in Läkaruppropet, I hope you can put a link.
I will put links in the description, of course.
Yeah, so there are some statements in English, few, but if you're Swedish, yeah, it's no problem.
Okay.
Find Läkaruppropet. If you want to look at my local party, and if you're from Sweden, you should go at www.malmolistan.se. Malmölistan.
Malmölistan it is. Okay, Nils Littorin, I'm truly grateful that you took the time to be a guest on Mind the Shift, and keep up the good work and good luck out there now.
Thank you. Bye-bye.
If you like this video and other interviews and talks on Mind the Shift, please like, share, and subscribe. I appreciate all the support. And you can follow Mind the Shift on Facebook and Instagram. And you can follow me, Anders Bolling, on all the main social media and also on medium.com. Thank you.